Hi Sim, so nice to see you again. So this
Okay.
is a continuation of our last session. And our last session was basically a practitioner to practitioner meeting so that I could help you understand how you can incorporate peptides into your practice.
Mm.
So how do you now feel since we've had that session?
Um, I feel way more confident because I have actually used peptides with clients before, but with the very basic, well, knowledge and extent that I knew it to. And then I've been talking about it on Twitter a little bit, and on LinkedIn. And then Jessica offered to assist me. And we've gone through this and not just the explanations, but like the mechanics, right? The mechanistics of things, mechanisms of action have been very valuable for me in particular, because I obviously want to understand how these things work and the context in which the clients and I find ourselves in, so I can use the right peptides. And that's been phenomenal, right? So now I've been adjusting my practice more so I can able to use this at a higher level, let's say.
Mm-hmm. Yeah, and we specifically focused on the cognitive peptides, right? Because I
Yeah.
deal a lot with people who have immunocompromisation, people who
Yeah.
are chronically sick from mold
Mm,
illness and chronic inflammatory response syndrome. But you
mm,
focus more on executives. So
yeah.
executive main goal is to have more cash flow in the business, and how do they generate
Mm,
that cash flow? It's by improving the cognitive function. So yeah,
yeah.
if I'd like to maybe talk about the cognitive peptides, which you now find interesting, that would be amazing.
Mm, yeah. So I think, I mean, it's at least becoming like a bigger thing, but we've talked a little bit about BPC because of the gut-brain axis, right? So BPC 157, and that's a part of the therapy that would be used with clients, and that I find myself very beneficial, that I've had used with clients before. And every time the feedback is the same, right? That one is actually quite good. So in terms of like how the gut regulates cognition, that's already like a major one. We talked about Celank. Am I pronouncing that right?
Alan and Samax, they
Yeah,
sodium.
Celank. Exactly. So these two peptides, as you know, for most of the cognition, seem to be the ones that popped out the most. And these I've yet to use, but in terms of like the mechanisms of action, seem to be our strongest contenders, let's say, for anyone to like get on their way when they want to amplify their cognition without really cumbersome protocols, right? Obviously, some things would
Yeah,
have to be addressed, but in terms of accessibility, because they're a nasal spray, that's really amazing, right? It's quick, it's easy, it checks all the boxes that my clients are looking for.
yeah, exactly. And then, like you said, it's so accessible because it's intranasal.
Mm,
So it's super easy.
mm,
And if you were to up ramp, there's also cerebrolizin, which Brian Johnson, he
mm,
wrote a very good review about. And then there's cortaxin as well.
mm,
Then there's PT
mm,
141, PE 2228. So there's a whole range of cognitive peptides that we can use and that
mm.
you can use in your practice.
No, exactly. And of course, like it kind of like goes up with levels, right? Or that's what we're trying to build anyway. Where people that want a low threshold protocol, like we'll give them the easiest ones, and people that want to advance into something more potent, then we can use the more of the injectable ones.
Hmm. So what's been your general response when you've started to ask your clients if they feel comfortable using peptides? Because a lot of people think that they're steroids and they're not, right? They're amino
Yeah.
acids. So they're well
Mm-hmm.
organized and well structured amino acid chains that
Mm-hmm.
interact with the cell and initiate an intracellular signaling cascade. So it's not a steroid, it's an amino acid chain, right? So do your clients
Yeah.
understand this?
I don't think there's anyone that has actually been very worried about it. I mean, especially when the explanation like you've given comes along with it, where it's like, well, it's a peptide, like it made out of amino acids, your body makes it. We're just like enhancing it by exogenous application. I don't think so far that there's anyone that has actually had any major apprehensions about it whatsoever. Most of them seem to be very embracing of peptides. Let's just say I haven't really had to convince anyone, especially given the benefits that they provide and that the risk to reward ratio is so high, right? There's barely any risk with it. So there's no one that looked at that and went like, oh no, this is not for me. So except for some people that might be a little bit more squeamish about the injections, it's actually been very, very, I don't know, like accessible to them and easy to get onto.
Yeah, I agree. When I explain to people how the mechanism of peptides work, it's actually very easy to get them to use the peptides. And when you explain that the needle is a 30 gauge needle, so it's 10 times smaller than an IV, this also ticks a lot of boxes. And it's just a little injection into the bum or into the subcutaneous belly fat. So it's, it's very easy.
Yeah.
Yeah, cool. So your clients are worldwide based as well, which is excellent because we actually have a supply chain that can supply Hong Kong, Asia, Middle East, USA, Canada, UK, EU as well. So you've had no issues with supply chain, right?
Not really. I think the only issues that we've had is might have been a customs declaration for Hong Kong or something, but like
Oh,
nothing major. I mean, that was sorted out as soon as that was brought to their attention. But outside of that, we've had no real issues. And seeing that people are bringing it into the places where I've done these like retreat style immersions, let's call them, right? With my client, like in Bali, and here in Turkey, it's not been an issue whatsoever. So even in terms of transporting them or getting them here, so that's been great.
yeah, that's awesome. That's awesome. Okay, so if we were to make up a client, so say I have a 39-year-old individual and I have had some cognitive impairment happening due to stress. And my lifestyle has been average. It's not been like a biohacker or someone who's into longevity, but it's not been totally inflammatory. And I want to improve my cognitive function. And I know that my gut is a big part of this as well, and so is my stress response. Which peptides do you think that I should use? And also, what would I have to do outside of peptide therapy as well? Because they're not a magic bullet. You need to be, incorporating them with adjuvant therapies. They can
Yes.
definitely move the needle. So they can move
Mhm.
the needle, but it's in part of a holistic, all-encompassing protocol. But yeah, let's pretend that I'm a executive, I'm 39, I'm male, and I've come to you. What would you say I do? So I've paid you and I'm working with you and you're looking after me. What would you say that I'm doing?
So whenever a client comes on board, like I do a pretty extensive assessment. And when the let's say the parameters that you've outlined are okay, like his gut isn't great, right? The food isn't amazing. That would be one of the first things that we're going to look at because if there's a dysregulated gut-brain axis, then I want to know first, like, okay, how are you eating? What are you eating? When are you eating? Right? Like in terms of everything that comes with stress around, like some people, many of my clients, especially in the past, right, they don't really take the time to eat. Um, it's all very rapid or like fast paced. So that would be one of the first things we're going to look at. So as you said, like adjunct therapies is really like a nutritional protocol. Like let's just have a look at what you need and where you might be, let's say, missing out on something. A lot of them under eat protein, right? So that's like that would be like the most basic thing. Um,
Fundamental,
yeah,
fundamental food pyramid, obviously.
yeah, exactly. And then we would start looking into like if we're going to use peptides, most definitely BPC 157. That's kind of a given, I feel. Especially again, like a very low threshold if we're getting oral capsules, right? Like that could be a thing. If we are going injectable, if they're feeling comfortable with that, like as I said, very minor needle, then it would speed up the process significantly.
Mhm.
Um, so that would be one of the main places to start. And then after the BPC cycle, just touch base. Like, what's your cognition like already? Maybe not much more is needed if we change this nutrition and use BPC. And depending on where he feels he is in, cognition, mood, focus, attention, we could just go like, okay, maybe that was it. Right? This is all that you needed. And if he goes like, okay, I want to go another step beyond, then we would introduce something like Celank and Cemex.
Okay, awesome. Yeah, I like that idea of phasing in the different therapies. So phasing in BPC and not just adding 3 or 4 different peptides in at the same time. That's really interesting. Yeah, that's very interesting.
And like, we want to make sure in that sense, which is also something that you've relayed to me, right? That if we take it step by step, then we can also gauge the effect quite well of what's working well and what isn't. If we stack everything at once, unless it's an emergency, we don't really know what's working. And seeing that, as you also emphasize, like, there's a difference between the target groups, and my guys don't need like a very invasive therapy to begin with. So then I can play it a little bit more, by ear, by prompting them like, okay, where are you at? What are you feeling? And then from there, take it to each subsequent phase.
Yeah, because you don't have people who have Lyme, mold, they're not chronically sick, right?
No, not at all. And if I would get someone like that, seeing that like it's not like I don't treat people, then they would end up with you anyway.
Yeah, yeah. Well, thank you so much for that. Thank you for the trust.
You're welcome.
So, what about if I was a CEO and I had very bad board meeting anxiety? So my company was performing extremely well, but for some reason I just had a mental block. And my anxiety before my board meetings was just very stressful for me. Would you recommend something like cerebrolysin? Would you recommend something like Cemax or Celank or BPC or all of these combined?
Good question. So again, like, if we ran a thorough assessment and I could give him drills to deal with stress to begin with, right? To let's say mitigate or at least diminish his performance anxiety, then we'd start looking into these therapies. I would start, I think it was the Cemax that also had more of an anti-anxiety effect. Because I get them mixed up sometimes with the names, the Cemax, Celank. So that's why.
It's amazing. Anxiety and
Yeah.
depression.
So then that would be the first one that I would run. And again, like, just step by step, like, we could stack that one with BPC, and I predicted that that would have a very strong positive impact kind of from the get-go because of everything. Like, as we know, inflammation in the gut can also produce symptoms of anxiety in the brain. So if we're tackling those two angles at once, right, one cognitively, like top down, and one bottom up through the gut, then we're kind of like tackling both angles at the root level, let's say. And I think that would be a very viable therapy or like protocol to start with.
Yeah, I agree. I like the use of Samax because it's very easy and he can instantaneously use the Samax intranasally around 1 hour to 30 minutes before his board meeting and really bring down the symptoms. That's really interesting what you said.
So the applications are, I mean, huge. I think it's such a kind of opening up. Well, I mean, there's always been like these levels of accessibility, right, in almost whatever substance that we would use. But in this case, when it's intranasally, it's so simple and so easy, and just kind of give it to them and they can roll, right? There's no performance anxiety or anxiety in using these peptides, and that's been also, I would argue, a very good way to get people on board without a lot of the apprehensions, right? And then, for again, like, coming back to that, for my clients in general, they don't want to waste too much time with things that like take too long, like complicated protocols. So it's been a very, very convenient and an amplifier for what I do.
Yeah, I agree. You know, we live in an echo chamber but you'd actually be surprised how many top performing CEOs just don't take any supplements. They don't even take magnesium. They don't really know what a stem cell is or an exosome or anything like this. And to us, it seems so common knowledge, but to them, they don't even understand L-theanine. It's a supplement that you can take from green tea and it's going to significantly help reduce your anxiety before the important meeting. So you have a huge,
Exactly.
there's so much market
Yeah,
there.
very true.
Okay, well, thank you so much for the interview. Do you have any last words that you'd like to say to everyone? I would just like to say thank you.
Well, thank you for having me on, and thank you for your guidance, right? So
Oh, it's my pleasure.
I I was really sort of waiting in a way for somebody to come along and make me more at home in the world of peptides. Because I even when I do a lot of my own reading, it's not always that I have the backing to put these protocols in their proper context, right? So in terms of dosage, because that also would vary, and with your help and your guidelines, now I'm well equipped for what I'd like to do or how I'd like to approach things from now on.
Well, your clients and everyone is very lucky to have you. That's all I can say.
Thank you. I appreciate that greatly.